again, underscore, I mean, it was a phenomenal day. Looking intently at who was there all day long, more than just the institutional involved individuals. I mean, there was people from the street that was there all day, right? Mm-hmm. I mean, that was pretty emotional, especially the workshops and everything. And I'm really interested kind of in a further debriefing on your next step follow-up to the attendees. Because a lot of individuals, unless they were associated with some organization, seem like, hey, I'm here because I need help. I need some direction. Mm-hmm. And was real energized by that.
Thank you. We'll definitely be sure to follow up with you for sure. Thank you.
Thank you.
Okay. I guess by default, I'm chairing the meeting, to be honest with you. Tobacco litter mitigation.
And Carson, I haven't seen you since I think I was here to give you an award in 2014 for passage of the Safe Medicine and Needle Disposal Ordinances. And we want to thank you again for all your partnership all these years. And we're very excited to report that you now have 70 medicine bins out and 25 needle collection bins throughout the county for all your leadership on those ordinances. But today I'm here to talk about tobacco litter and mitigation. Again, I'm Heidi Sanborn, the Senior Advisor to the California Product Stewardship Council. I'm now full-time, or not full-time, but part-time working on the National Stewardship Action Council and taking all the work that we've done here in California to other states, including medicine take-back ordinances and statewide bills. But I'm here today to talk about the tobacco litter and what we can do about it, because it is a public health issue. It's an environmental issue. Kids eat the butts, they get sick, the pets eat them, they're going into the waterways, fish are getting poisoned. In fact, I've seen a video recently of minnows where they actually put leachate from 10 cigarette butts into water and poured the water into the tank, and literally within 30 seconds, the minnows are into convulsions and upside down. So, and this is the most littered product in the world. They're the most littered product on the beaches, and they're causing us a lot of stress trying to figure out how to get them out of the waterways, because we're going to end up with trash total maximum daily load fines, and 25% approximately is due to tobacco waste. So I'm going to talk a little bit about the policy approach that obviously we all work together on safe medicine and needle disposal, and how we followed through on that, and then how can we learn from that to then do something about tobacco waste. So this is our board now. It's from people all across the state and local governments, including LA County, and your own Alameda Stop Waste, Justin Lehrer, is on our board, and we're very appreciative. And our mission, again, is to shift our entire waste management system away from one that's focused on government financing and one that relies on producer responsibility. It's to reduce public costs, but it really is to drive improvements in product design, because when the manufacturers have to pay for the end-of-life costs, they work to get them down. And just a little overview of all the different variations of producer responsibility that we have here in California. On the left is the medicines and sharps, making the producers pay, making them do the oversight, government doing the oversight, but they implement the program. All the way to the right, which is voluntary stewardship for things like 1-pound propane cylinders that have been redesigned to be refillable, and that was done by the manufacturers. There's a lot in between. So there's different flavors of producer responsibility in different amounts. And again, it all started really with this county and your board, which voted unanimously for the ordinance in July of 2012 already, 7 years ago, to pass the first ordinance in the country making the drug companies pay for a safe take-back of medicines. And that led to 13 ordinances in California. I think we have 5 in other states. No, 5 in Washington, 1 in Chicago, 1 in New York, and states are passing these bills now, including Washington State passed it last year just for medicines, and then, of course, last year we passed it in California for medicines and needles. And because you fought all the way to the U.S. Supreme Court to do this, it's now opened the floodgates for counties and cities across the country to say, if there is a public health issue, that you can use producer responsibility as a tool to get the product addressed. And again, we gave you an award. In fact, the award to the whole supervisors is in the back glass, I noticed. And thank you again for all your leadership on this, and Supervisor Carson for yours on sharps. But it was a full board unanimous vote. And again, this led to all these other ordinances just in California. And again, we're proving the point that this is a policy tool that can be used for products like tobacco. So the key elements of the bill that passed last year as a result of all your work makes sure that it's safe and convenient for medicines and needles to be disposed of. But, and it's to prevent addiction, which is kind of with where tobacco, we want to prevent people from smoking. We don't want a whole lot of smoking. We certainly don't want all the litter. And there's ways to address that in these EPR approaches. The enforcement is done by Cal Recycle, and they're in the process right now of doing the regulations. And it was precedent setting. It was the first bill in the country that did both medicines and needles, addressed where the manufacturers have to be responsible. And the programs are separate. It was the first to require that they have to be a 501c3 for public benefit corporation. We learned that through the old ordinance. We needed to be specific because pharma was doing a C6, which is for their own member benefit, not for the public benefit, so they could hide the ball, delay, and so forth, and that was legal. The first to require reimbursement of disposal costs. So on needles, we required that the mail-back container be provided at point of sale, but also that any local government collection of needles would be completely compensated for by the producers. That's precedent setting, and that's never been in state law before that we know of. So that is another tool that we can use in the toolbox for tobacco. And it was the first to prevent promotion of disposal, which was not in the program. So for example, trashing or flushing. They were wanting to educate people to trash medicines, and Alameda said no, and then they said, well, you know, we could sue you because it's legal, so then you have to make it illegal. So we have to be careful about what we ask them to do on public education. And maybe the county does it and then ask for reimbursement. And again, this is the needles. Upon request, the program provides for reimbursement to local agencies for disposal costs for sharps waste. That's a first. And the reason is that if people are given a safe return container and mail it back and that works, great, they won't end up in this facility. But if it doesn't work and they don't do a good job on the program, we are making them reimburse you for those sharps collected at the public facility. And that's another policy tool we could use for tobacco waste. So this was a really big win in the bill. We had no visible fee, just like your ordinance. Required a 501c3 for public benefit. Covers all the medications, including over-the-counters and sharps. It's timely bin collection. If they don't collect it on time, there's penalties. And for sharps, it's, again, a free mail-back container at point of sale where people need them immediately. They have a container at home. And this was just the last one on this, is the quote from the pharmaceutical group at the time, that these statutes are taking off. We see there's a movement in California to expand beyond the pharmaceutical industry, such as maybe tobacco. This is the first time where a county or local government has reached out and forced companies in another state to provide a service to their local residents. That was their argument at the time, and they lost. So the good news is you've paved the way for the country to look at how do we use this policy tool for other products, like tobacco waste. So with this, I'll just start by saying again, the most littered product in the world. It's causing a lot of damage to wildlife. And again, it's dangerous for kids even, the tobacco waste and litter. And when they eat them, there's nicotine, there's toxic chemicals in these filters. And a lot of people think that the filters are cotton or some sort of biodegradable product. It's actually acetate, it's a plastic. And there are some studies that say it's actually worse for your health because you're pulling hot air through this fine fiber of acetate and breathing it. And there's this odd kind of lung cancer that surfaced after these filters were put on the market. So they don't even provide the health protection that people think that they're providing. So really, what is the purpose of these filters, except that they're doing a whole lot of damage? Just in 22 hours of collecting tobacco filters in the streets of the city, for 22 hours, and even in smoke-free parks, your staff collected 11,740 butts. All of them probably going to get washed out into the ocean or turn into microplastics in the soil. And this is exactly the amount of butts that were collected. Not very appetizing to look at, but that is what's all over the streets of every community in the world because of these filters. The other audit that your county has done is with the unincorporated area, and it was done on a 2-mile strip over a 2-week period. And they collected over 1,000 butts, but they said that this is also a part of town where the street team is cleaning up 3 times a week. So even with 3 times a week cleaning, we're still finding thousands of cigarette filters on the streets. So what can we do? One of the producer responsibility options is to require the industry to establish a stewardship organization, very similar to the Meds and Sharps, to collect the tobacco waste from the county parks, the beaches, the streets, storm drains, and public spaces. Or to require the industry to establish a take-back program. But it's kind of hard with a product that's literally on fire and people step on it to put it out because they don't want to start a trash fire. So it's almost just a failed design because they have to go on the ground in most places to put them out unless there's an ashtray nearby. People step on them and then they don't want to pick them up. So there's mail-back options and other things that could be done with a producer responsibility approach. Another approach could be stewardship, meaning it's some producer responsibility, but not all. So 4 different options are what we thought of here. And actually, we did this in concert with the California Department of Public Health and your county staff from the Public Health Division. And so the first one is studies to get reimbursement for your expense on studies, audits of tobacco waste, the extent of the problem, establishing a baseline. Another one is to get reimbursed for the total, any fines you might receive from the state for the water pollution and catchment basins that are being required now because they can't filter all this out. Some will always get through, and the fines are big. 3 is for education and outreach. You could be reimbursed for any educational messages you want, including litter prevention signage. And then 4th is for the e-cigarette collection at household hazardous waste facilities, retailers, schools, and public parks. I want to say that at schools we're finding a lot of the Juul, smoking devices. Those are hazardous waste, and they're causing the schools to spend a lot of money on hazardous waste because the kids are first not to have them at the schools. But then when they bring them and they leave them behind, they are a hazard. They've got lithium-ion batteries in them, and they've got nicotine. So they're literally hazardous and toxic. So that's a problem for the schools. And then there's green design policy options. So you could require in an ordinance that single-use filters are banned for cigarettes. The tipperillos, those plastic tips that end up on the streets, those could be banned. And also single-use electronic smoking devices. And enforcement, of course, is critical. And so if you do decide to go with an EPR approach, it's important to, and we've learned so many lessons from the original ordinance passed here in Alameda, and the staff have lots of great suggestions. Just requiring a clear implementation timeline, limiting the number of times the plan could be revised. They have to get it right by the second time, and imposing penalties large enough to the producers to actually really make a difference. So again, Governor Brown did sign SB 212, which was based on your original ordinance, and we're all very proud of that, and thank you for your work. We've developed a lot of partnerships to get SB 212 passed, as did you to get it passed here in the original county for Meds and Sharps, but we'd have to do the same thing for tobacco. There's lots of groups like First Five, the litter groups, the water groups. It's a lot of the same groups, actually, that would care about tobacco. And having a strong media presence, making it not cool to be throwing cigarette and tobacco waste in the streets. We've done a lot of things like live television. You could do that here. That was me with Mayor of West Sacramento, Christopher Cabalden, when we put in a medicine bin, one of the first ones in the state, after Alameda, actually. And then we also educated electeds like yourselves at the U.S. Conference of Mayors. And I spoke with them about what they could do in these policy tools for medicines and other products. And having an effective PR program is key too. The state actually has made a tree out of cigarette butts. And that is a great visual way to explain that we're losing trees because we're making all these cigarettes and filters and all the waste. And it's just the visual that the state of California developed. So lastly, to successfully pass policy, which you've done exquisitely in this county, It's just connecting the dots that you've already connected before, which is to develop and educate advocate partners, collect compelling data, which the county's already done a lot of, reaching out to the industry first, then doing some sort of pilot if they're willing to try it, finding political champions like yourselves, copying what works, media strategy, and then go local first and then the state, and never ever quit. And I would say that Senator Hannah Beth Jackson, who passed SB 212 last year on pharmaceuticals, called me into her office and asked, "You did such great work with us last year. What's the next big thing we're going to do before I leave office?" And threw out some ideas, and she said, "Let's go after big tobacco." So she's got SB 424 that will be introduced in the next couple of days, and it's a fleshed out version, but she's very serious about going after tobacco waste and the public health and the environmental damage that it's causing. So if you do decide to go with an ordinance, we will have a state vehicle at the state level that it would push towards, just like with the pharmaceuticals, so you wouldn't be completely on your own. We've also talked with multiple other counties, and they're all looking at this. So it could be, if you're interested, that Alameda's first again, or maybe with some partner counties that are also interested in doing these sorts of ordinances. And we're not saying we know the right way or advising you to go one way or the other, but if you do choose to do something, we'd love to work with you on it. And we're under contract with CDPH to deal with this issue, and just had a full day workshop on it last week at their offices in Sacramento. So I'm happy to take questions or thoughts.
Thank you.
Heidi, I'd like to speak to you after this hearing, if you don't mind. Okay, thank you.
I want to, any other questions? I really want to thank all of the hard work that you've been doing over at the California Product Stewardship Council. It's been incredible work, and I'm sure that our county would like to work with you in looking at future ordinances. So that might be something that comes through the Policy Administration and Legislative Committee at some point. So feel free to reach out to our offices regarding that.
Great.
And appreciate the ongoing work that you've been doing.
Great.
Thank you.
Well, thank you very much. I'll speak to you later. Thank you.
We have a couple of, want to call them up? You can call them up.
Leslie Zellers, Elsa Casanova, and Claudia Rodriguez Briones.
Thank you. You each have 3 minutes.
Good morning. My name is Leslie Zellers. I'm a resident of Oakland, and I'm a member of the Alameda County Tobacco Control Coalition. As you've just heard, cigarette butts and tobacco waste are toxic to the environment. Many people, as Heidi said, many people believe that cigarette butts are just plastic and they will biodegrade. They're just paper and they'll biodegrade. They're actually plastic. They're cellulose acetate, and they get in our waterways and damage our streams and wildlife, and young children eat them. Almost 1/3 of the litter collected in all of California is cigarette butts. And for this issue, we're talking not just about the butts, we're talking about all tobacco product waste. So if you look at the streets in your community, I know I see a lot of the Swisher Sweets packets, the foil packets for the small cigarillos. We've just heard about the e-waste too, that we're seeing more of that kind of waste, and also the plastic tips on the cigars. This, as I said, is all toxic to the environment and to people. So I really urge the county to take some action that would either remove these products from the environment to begin with by redesigning them, or making sure that the local government is not shouldering the burden for the cost of the cleanup and pushing that onto industry. Thank you very much.
Good morning. My name is Elsa Casanova. I'm also a member of the Alameda County Tobacco Control Coalition, and I have been serving the unincorporated area of Alameda County as a community organizer for over 3 years. Over those years, we have held many community cleanups, and I just wanted to share that last year I had a couple of youth in my cleaning team who decided to take it upon themselves to count the number of cigarette butts that they collect. They ended up collecting over 300 cigarette butts over the course of 90 minutes. And they actually decided to stop counting because they got so tired of doing it. They just said it was too much. And so that number doesn't include other types of tobacco litter, such as product packaging and containers. It is known that tobacco product waste contains all the toxins, nicotine, and carcinogens found in tobacco products, along with the plastic non-biodegradable filters attached to almost all the cigarettes sold in the US and in other countries around the world. This litter ends up, it's not only littered all over our communities, it also ends up in the oceans, in our water systems, as Heidi mentioned. And there have been toxicity studies that suggest that compounds leached from cigarette butts in salt and fresh water are toxic to aquatic microorganisms and test fish. Additionally, as has already been mentioned, from 2006 through 2008, the American Association of Poison Control Centers reported 14,000 injuries from tobacco products to children. 90% of those were from the ingestion of cigarettes and cigarette butts. I just wanted to ask that you please keep in mind these environmental and health ramifications as you consider how to move forward in addressing the environmental impact of tobacco waste. Thank you.
Thank you.
Good morning. My name is Claudia Rodriguez Briones, and I am the supervisor for the Community Health Education Department for La Clínica de la Raza. And I'm also a member of the Alameda County Tobacco Prevention Coalition. Today, I'm going to be talking to you guys about the experience that our youth, our peer health educator, and our staff, our health educators, had in picking up tobacco litter. Actually, we were able to pick up 1,107 butts in most Oakland parks. And what happened was very interesting because the youth and I, as we were picking up the litter, we started seeing that a lot of the times this litter was concentrating mainly in the flatlands and not in the parks that were actually up in the hills. And we started discussing this because it is a problem. It is something that is hurting our children and usually happens in the flatlands. When we were doing a pickup on any college, I started just looking at the whole area, and I noticed firsthand that there was syringes next to the cigarette butts. And I talked to them about it, and I say, why do you think it's that? And again, we came back to the same idea. Why is it that we, in this area, in the flatlands, we have to deal with that? Why there's no any other solution to be able to mitigate the problem with tobacco butts and other products? Today, I really want to urge you to support us in finding a solution that can actually make the company and manufacturers be responsible for their waste. Because at the end of the day, it's not only the person who chooses to smoke that is suffering, but everyone else is suffering as well. Thank you.
Thank you very much. No other speakers? I really appreciate all of you for being here today and those who wanted to speak out on this issue.